Hello, everyone. I am Yanetto Barrio Sanchez, and here you have joined us, or as folks are starting to join us on Facebook Live and on YouTube Live, I welcome you to this month's Stroke Awareness Month, and it is our live with some of our amazing experts that we're going to talk to today. Did you know that some strokes might be preventable while others are not? We're excited to bring you a Facebook Live and YouTube Live discussion with two memorial experts, Dr. Helen Valentine Chukwu, primary care physician at Memorial Primary Care, and Dr. Harris Kamal, neurointerventionalist with Memorial Neuroscience Institute. Welcome, doctors.
Thank you,
Thank
Janet,
you.
for having us.
Good
Appreciate it.
afternoon. Thank you for having us. Pleasure to be here.
Amazing. We're definitely excited to talk to you both. We have a comprehensive range of topics related to stroke, including some causes, risks, symptoms, prevention strategies, which is very important, treatment options, warning signs, and much more. And later in our chat, we're going to welcome one of Dr. Kamal's patients, Luisa. She survived the stroke at the young age of 47, and she's going to talk to us about her experience and where she's at now. As right before we get started, we always say the same thing. We are live, ladies and gentlemen, so things can happen. So bear with us if we have any technical difficulties. We'll be right back if anything happens. And also, because we're live and we have our experts, you can chat with us and you can send us a few messages, and we will try to answer as much as we can during this live. You can also tag any friends that you feel can benefit from today, knowing that perhaps maybe they've had a stroke in the past or they're interested because of a family history or anything of the sort. So, anyone who can benefit from this stroke talk, particularly all of us who need to know the signs, go ahead and tag your friends and family, especially if you're on Facebook, so that they can see this video. All right. So I gave everybody a couple minutes to sign on. I'm hoping we have everybody here because we're going to get started with Dr. Chuku. Um, and being that Dr. Chuku is a primary care physician, we want to talk with her about things that we can control, right? Some of those things that she talks to her patients about that we can make a difference so that perhaps we can lower our risks of stroke. So, Dr. Chuku, I kick it off to you.
Yes, good afternoon. Now, stroke, this is a very interesting topic because oftentimes, a lot of times, my patients, they come in and they have what we call these modifiable risk factors, such as conditions such as elevated blood pressure or diabetes or high cholesterol. And sometimes they really want to get that true understanding of why do I truly need to bring my blood pressure down, say, under 130? What's the significance of this? We know that elevated blood pressure can possibly increase a person's risk of stroke. So I make sure that patients understand this is a partnership that we're here together to work with so that you can get the best possible outcome. Even just today, I had a patient with elevated blood pressure, and they wanted to know, well, say, doc, what happens if I don't take my medication? Can I get a heart attack? Can I get a stroke? We began to have that conversation. And as we were talking about stroke, I was explaining, the stroke is an event that affects the brain. Our brain is critical for our function, our thinking, our ability to produce executive functions. And when this happens, the blood vessels that supply oxygen and nutrients to the brain, it can either be blocked or there could be a rupture of the vessel. And when this occurs, our other areas of the brain that receive those are to receive those nutrients and the oxygen are unable to get that. So we need to do our best to make sure that we get the best possible blood pressure reading by reading labels, which can be helpful. According to the American Heart Association, if you can identify a low sodium level when you read a label of under 140 milligrams sodium per serving, that can be helpful to reduce your blood pressure without even using medication. So my goal is to try to take you off medication when you're at a good, healthy state, but we have to use a whole mind, body, spirit approach and adopt that healthy lifestyle. That's the utmost importance.
Well, and thank you for that, Dr. Chukwu. So we talk a little bit about blood sugars and cholesterol and some of the things we can control. Um, and I want to invite Dr. Kamal because Dr. Kamal, I'd like for you to tell us a little bit more about what exactly a stroke is in our brain and what are some causes that really we can't control.
Thank you, Janet. Yes. Well, that was very eloquently put by Dr. Chukwu. So, really, to kind of go over what she just brought forward, a stroke is blockage of blood flow to a part of the brain, which is the dry type of stroke, the ischemic stroke, which is more common. It's around 85 to 87% in all comers. The other type of stroke that one can have is bleeding inside the brain, which is less common, but still, equally problematic and dangerous. Now, when a stroke happens, it can happen either from one of the smaller arteries in the brain getting blocked off because of a clot forming there, or it can be from a larger artery where a big artery or a big pipe got blocked from a clot that traveled either from the neck or from the heart. And so, one of the ways to think about really the arteries or the pipes that supply blood flow to the brain is like the branches of a tree. They keep getting smaller and smaller as they keep going up towards the head. And yet, the end result of a blockage of any of these arteries would be some kind of a neurological deficit that we'll cover in a little bit. The causes are really, the important thing to realize is a stitch in time will save nine in the brain. So as Dr. Chukwu mentioned, the most important thing that we can all do is to stay healthy, control blood pressure, control the blood sugars, manage the cholesterol, eat a healthy diet and a lifestyle. But if somebody does start to have some symptoms of a stroke, then the most important thing that should be done is to come into the hospital right away. There is no reason to think that, you know what, I'm going to go to sleep and this will get better, or this will pass. Maybe I'm just thinking it too much. Any symptom that we'll cover in a bit can lead to really a big stroke evolving in the next few minutes to an hour.
Yeah.
And really,
Dr. Kamal, I'm so sorry to interrupt. It seems that we're having some technical difficulties, as sometimes it happens in the lives. So we're going to go ahead and disconnect for a second, and we're going to get back on. So
sure,
everyone who's watching is going to give us a minute, and we will be right back.
sounds good. Thank